So we started to discuss the nervous system, okay? And we've talked about the bacterial causes of bacterial meningitis, which were, I want to remind you really quick. We talked about this, the bacterial meningitis caused by Neisseria, okay, meningococcus, strep pneumonia, the pneumococcus, and Haemophilus influenzae. It turns out all three major meningeal infections, bacterial meningeal infections, can be prevented by the vaccine. Okay, we talked about Listeria, which is much less common cause of meningitis, mostly affects immunocompromised and newborns. We talked about Cryptococcus infection, which is fairly common among immunocompromised patients, especially AIDS patients. Actually, when we talk about AIDS patients, we should always keep in mind the opportunistic infections, which are mostly fungal. And I don't remember if we actually get to this, but maybe we did, maybe we didn't. But Coccidioides immitis is another fungal infection, which is fairly common in the southwest United States. It is also called valley fever. Essentially, it's a mold, okay, and those arthrospores, when inhaled, can cause pulmonary symptoms, and actually when they become systemic, when the fungal cells reach brain, they may cause meningitis. If they are spread to the bones, they cause osteomyelitis. Okay, as in any case, we should talk about, people can be genetically susceptible based on their immune status. Some people are genetically more prone to fungal diseases than others. In fact, I have a student in another micro class. She has been suffering from fungal infections of the skin since she was a kid, and she deals with that on everyday basis. So it's probably a combination of genetic and microbiome factors that affect her condition. Now, the diagnosis is symptomatic, and also isolation and PCR or antigen testing. Now, isolation of Coccidioides must be done in the special biocontainment suit. Now, when we say biocontainment, it means that the personnel has to protect themselves against the possible infection with the respiratory transmitted. Although, as any other fungal infection, it can be successfully treated with a antifungal like fluconazole. Okay, and the next thing that we're going to talk about is viral meningitis. Viral meningitis is often called an aseptic one. Aseptic, it doesn't mean that it's sterile. It means there's no bacteria involved. Most of the cases, viral meningitis happen in children. And probably the most common infection that causes meningitis is the variety of enteroviruses. Now, what is the enterovirus? You know one of them, it's polio. Okay, but there are many others that cause similar symptoms, that cause inflammation of meninges. And now, important thing when we talk about enteroviruses, again, it's the problem with taxonomy. You may have heard about recent outbreak of enterovirus D68, which turns out to be a respiratory transmitted infection, which is associated with flaccid paralysis. The number of viruses that are related to each other, enteroviruses, rhinoviruses, is huge. We talk about hundreds of different species. They all collectively called enteroviruses, although not all of them, and actually just minority of them is transmitted by fecal-oral route. Okay, so when we talk enteroviruses, we talk about a lot of them. Okay, many viruses that may cause meningitis. Okay, not a single enterovirus, but many of them. Coccidioides belong to the same group as enteroviruses, although they are slightly distinct, as do echoviruses. Arboviruses. Arbo stands for arthropod-borne, which means, anyone? Transmitted by arthropods, yes. Ticks and mosquitoes mostly. Okay. So among arboviruses, there are infections like West Nile virus, St. Louis encephalitis, California encephalitis. So they cause both meningitis and meningoencephalitis. So that means not only meninges, but also brain parenchyma is involved. Herpes simplex can cause meningitis, and so enormous number of viruses can cause meningitis. And as I mentioned, these are the most frequent, and we're going to focus on these guys. These are much less frequent, so they can cause, but it's not that important. I'm not going to really focus your attention on that. Okay. Now, how do you diagnose it? What do you think is the main problem with the diagnosis of viral encephalitis, if it is caused by such a huge variety of agents? Similar symptoms, all different agents. So you can't really precisely detect what is causing the disease. Make sense? So essentially, what we have to focus on in terms of diagnostics is the difference between bacterial and viral meningitis. And a couple of most striking differences is the color and glucose concentrations in the cerebrospinal fluid. In case of bacterial meningitis, cerebrospinal fluid appears to be white in color, while viral is clear. Any idea why? First of all, bacterial growth. So bacteria, can it grow in CSF? Hypothetically, completely hypothetically. Can it grow technically? Can it grow in CSF? Does it have nutrients in CSF? Yeah, so why not? Pretty much why not? Can viruses grow in CSF? Why? Yes, there are no cells. They are intracellular parasites. If there are no cells, they're not going to grow. Second, the glucose levels. It's one of the most characteristic parameters that distinguish between bacterial and viral meningitis. In bacterial meningitis, glucose levels decreased. You can see it here. Why? Exactly, bacteria is consuming glucose. Okay? So that gives you an idea that, because what is now in clinical aspect, what will be the difference then in terms of treatment between bacterial encephalitis and viral encephalitis? Meningitis, sorry. Can you treat bacterial? Sure, with antibiotics, antimicrobials, like tetracycline, vancomycin, whatever. Can you treat viral? You have what? Acyclovir, if it's herpes simplex, and that's about it. Other than that, you have no option of treatment. You have to control inflammation and wait for immune system to resolve the issue, right? So that actually defines the clinical course of treatment for these two types of infection. Does that make sense? So neonatal meningitis is sort of a separate condition that can be caused by the bacteria typically not found among frequent culprits for bacterial meningitis. So we talk about Streptococcus agalactiae and E. coli. Both of these microbes can be found in the birth canal. Now for both of them, it's not a common place to be, but they can be there nevertheless. Okay. Now, for a mother having a proper microbiota in the birth canal, presence of either E. coli or Strep agalactiae may not bear any danger. Okay, because the microbiome controls the spread, controls the effects of E. coli. So we discussed the potential, that women can accidentally transfer intestinal bacteria into the vaginal microbiome. That can happen. Okay. Now, it doesn't necessarily mean that there's immediately going to be infection. Okay, my local microbiome can control it. But when baby comes through the birth canal, children, you can consider them being pretty much naive in terms of microbiome. So if E. coli takes hold, it can, and it can get into most unusual spaces like nasal cavity, and it can establish itself, can get into the bloodstream, and can get into the brain, cause meningitis. Another one is Listeria Monocytogenes, which is orally transmitted. It usually causes mild infection in adults, but in newborns, as we saw before, it may lead to the neonatal meningitis. So Strep agalactiae, E. coli, and Listeria monocytogenes. So I know that looks like really huge. This is the convenient point to focus on what I want you to know, what I want you to pay attention for the final exam. So this is, for example, this is the summary of various organisms that can cause meningitis. Of course, I don't really want you to know all the details of treatment. Whether you treat, Streptococcus with cefotaxime or with vancomycin or penicillin. Okay? What you need to understand is that we treat bacterial diseases with antibacterial drugs. We treat fungal diseases with antifungal drug. So for each of these organisms, you pretty much have to know whether it's bacteria or fungus. Does that make sense? So if I ask you, you have a patient with a cryptococcal meningitis, which of the following drugs you are going to prescribe? Antibacterial, antifungal, or antiviral. So I have to identify that Cryptococcus is the fungus. Does that make sense? Transmission route. Please know. Virtually for all of them, it's a droplet transmission. Some of the viruses, it's a fecal-oral route. Prevention. When I talk about prevention, I want you to focus on whether the vaccine is available or not. Does that make sense? Distinctive features. If there's something, I focus your attention on the distinctive features of each infection, like petechia in case of Neisseria meningitis. Okay. Listeria and Strep agalactiae causing neonatal infection rather than infection in the adults. Does that make sense? Any questions on what you have to focus on? Yes. For treatment, you have to know whether you use, say, have a question. A patient with meningococcal infection will be treated with antiviral, antibacterial, antifungal. Pick one. Okay, does that make sense? So you pick what is the actual, what based on what the organism is, right? Is that understood? Is that clear? Good. Meningoencephalitis. So meningoencephalitis is the involvement of both meninges and the brain parenchyma. Now what is, so I frequently use brain parenchyma, the phrase. Anyone, what does that mean? Brain parenchyma. Brain parenchyma. What does that mean? What is the, if I talk about meninges, and then I talk about brain parenchyma. No? No? Huh? No, that's meninges. That's meninges. Brain tissue, okay? So, like, if you watch this, the sequel to The Silence of the Lambs, I think it's called Hannibal, in the end, he kind of cuts the piece of the brain of one of the FBI agents and cooks it, okay? So that piece of the brain is brain parenchyma, okay? What you see in the AP1 lab right there, that plastic thing that represents the human brain, the model of the human brain, that plastic thing represents the brain parenchyma, okay, brain tissue. So when we talk about meningoencephalitis, we talk about involvement of both meninges and parenchymatous tissue of the brain. Now, one thing that I want to mention, that in many cases, meningitis, for example, viral meningitis, can develop, if left untreated, into meningoencephalitis. Viral encephalitis can spread and involve meninges. But in case of these two protozoans, we talk about the infection that immediately involves both structures, meninges and the brain itself. So first causative agent is the Naegleria fowleri. It's an amoeba that is normally a soil dweller. Can be found in soil, and what is more important, it can be found in the warm ponds, lakes, usually more or less stagnant water. Not so much, not in the streams, but in the stagnant water. It comes there from the soil. And it is common in the southern states, Texas, those southern states that are humid, Texas, Alabama, Mississippi, Georgia, Louisiana. When kids play in the water, and believe me, that water can be really, really warm. Like 90 Fahrenheit, 95, it feels like you're swimming in pee. So kids play, they snort, right? They do all kinds of stuff. And water gets in their noses. There's a little plate right here in the roof of your nasal cavity called cribriform plate. If you would go back into the AP1, or you remember, I see. You go in the AP1 and you take the model of the brain and you remove the dome of the brain and look inside. In the anterior cranial fossa, you're going to see the cribriform plate, and has a lot of small, tiny dots. Those dots represent the openings through which your olfactory neurons reach from the olfactory epithelium in the nose to the olfactory bulbs. Long story short, the amoeba goes through the cribriform plate and ends up in the nerve. And then, it's only a matter of time until it reaches the brain and starts to replicate there and eat it. That's the only source of organic matter available for protozoa. So this is called primary amoebic meningoencephalitis, or PAM. It's extremely severe disease, usually manifested with the very high fever, severe headaches, confusion, various sometimes motor impairments, seizures, So a vast neurological involvement. The problem with that disease is that we have just several cases a year, although they're quite regular. And diagnostic of these cases is complicated because you don't know what's causing it. Unless you ask, did the child swim recently in the warm water? Then, so death can occur if it's not diagnosed and it's not aggressively treated. Death can happen in 24 to 48 hours after onset of symptoms. Okay. Treatment involves mostly amphotericin B. Okay. Which, as we discussed before, is antifungal. But it also works fairly well on the protozoans because they all, eukaryotes, and they affect fairly similar structures. Another source of amoebic meningoencephalitis is Acanthamoeba. For example, Acanthamoeba castellani. So this one invades mostly through the damaged skin and conjunctiva, so through the eyes, and this causes slowly progressing granulomatous amoebic meningoencephalitis, which is a tongue breaker, which means that in patient's body, granulomas are formed, little lumps. And as you can imagine, formation of granulomas in the brain leads to the neurological impairment, which usually involves manifestations such as changed mental state. So the person's character can change. It can involve infiltrations in the brain, so that means seizures often, motor impairments, and so on and so forth. But this infection can develop fairly slow. Does that make sense? It may actually be months. Okay. For example, there's another one that is not present in the U.S. but is widely present in South America called Balamuthia. I don't remember the species name. There were cases that required months of development, and they may enter, it can go through the skin, for example. Okay? Like kids play outside, they scratch their knees, it gets through the knee and causes then infiltrations in the brain, for instance. Now again, the treatment is amphotericin B. It's more, like, prognosis is better with granulomatous encephalitis because people usually have, doctors have longer time to diagnose it. Okay, but as with any eukaryotic disease, the treatment is sort of more futile, I would say. Now these are my favorites. Those are viral encephalitis. So you can see a whole bunch of what I call an alphabet soup. SLE, E, W, LAC, WN, and whatever. Okay, so what do they mean? In virtually every acronym there, E means encephalitis, E at the end. Okay. So when brain tissue is involved, the signs and symptoms usually involve confusion, fever, different grade, may involve seizures, in most cases, temporary or permanent motor impairment. Does that make sense? So people who actually survive after the infection may have a long-term or permanent impairment of, like, hand or foot paralysis and other muscle paralysis symptoms. Most of these encephalitis are arboviral. We've already discussed that it's arthropod-borne. And for virtually all of them, well, at least all presented here, they are transmitted by mosquitoes. Those guys right there. Okay? So all these are mosquitoes. As far as I remember, it's I spelled it correctly. This is the exemplary structure of Western equine encephalitis, one of the representative viruses that cause encephalitic disease. Now, there are several common things among those viruses. First, and I would say the most important of them, is that most of them cause so-called biphasic disease. So think about this. Not every mosquito carries the virus. Usually we talk about 1% of all mosquitoes. Even if the infected mosquito bites you, the chance for transmission varies between 1 and 5% during that bite. And even if the virus gets into the blood, you may have no symptoms, or you may have on the first phase of the disease, which is often described as quote-unquote flu-like illness. For some of those viruses, I told you about the dengue, that characteristic, if that military gentleman would be able to reach for the gun, he would kill himself. A lot of those viruses, the first stage of infection, much more severe than flu in terms of just general not well-being. But in most patients, first stage, that flu-like illness is what they end up with. Although in some of them, the encephalitic disease starts with the brain involvement and everything. Now here's the thing, why we're so afraid of mosquitoes. Just think about this. When there was a huge fear about West Nile, for example, why people are so scared? So getting bitten by a mosquito. You don't know if the mosquito is infected. If it is, you don't know if you get the infection or not. If you get the infection, you have no way to predict whether you're going to develop encephalitic disease. So you're pretty much like playing lottery. But in this case, if you win, you actually lose. Okay? So it kind of sucks. So that's why people are so scared of these diseases. Although, to be honest, the Western equine encephalitis, which is the RNA virus, okay, causes very infrequent infections in humans. Okay, not very many infections. Mostly children and infants are susceptible because the immune system is not fully formed yet. Although in horses, this disease is much worse. That's why, the name equine. The mosquitoes of the genus Culex, like Culex pipiens, for example, they transmit the infection. These mosquitoes are commonly found in the New England, actually all over the United States, but especially in the marshes on the eastern shore of the United States. There is no approved vaccine. It's important. What does that mean? Any ideas? Do we have a vaccine, generally speaking? Well, we do, but we can't use it for a general population. Which means, if I decide to work with Western equine encephalitis, I'm going to get vaccinated. But this vaccine is not FDA approved. Okay? So I can't start selling it. You can't go to your doctor and tell them, look, can I get a vaccination against Western equine encephalitis? The doctor will say, no, you can't. We don't have an approved vaccine. Okay? We don't have treatment, so if you're unlucky, you are unlucky, although generally in most cases this infection is self-resolving. The lethality rate for Western equine encephalitis is quite low, unlike for Eastern equine encephalitis, which I wouldn't say common, can be found in the eastern United States. This is, so you can appreciate, that's the number of cases in 47 years. So it's not very frequent infection. But we don't really know how many people were asymptomatically infected or developed just the first stage of the disease. Right? It's way more severe fatality rate is very high from equine encephalitis, and this infection is considered a select agent. Anyone knows what the select agent is? It's an official term. What's the select agent? It's a classification that is given by USDA and CDC together. Any idea what the select agent is? It's bad. So the infection is high mortality rate. The select agent classification means that this virus is considered to be a potential biological warfare agent. So when you work with it, you have to follow fairly strict guidelines. Those guidelines actually involve one very unpleasant thing. You have to account for every sample of the virus. And the lab that I worked at, I personally didn't work with Eastern equine encephalitis, but some folks did. And when they collect virus, they have to label it immediately, put it in the catalog. They actually label where they store it, so special people from USDA can come in and check and find it. And by the way, the non-compliance to the requirements is the federal felony. So you can go to prison for, I think, 2 years if you're not compliant with the requirements. Like if they find something that is not in the catalog, or vice versa. If they look in the catalog and the sample is not there. Okay? Now, that lab was about to relocate to Pittsburgh. And they cataloged everything, and they were ready to ship, and they actually shipped those samples to Pittsburgh, and they were ready to ship other samples, which were tissues from mice infected with Eastern equine encephalitis, which shouldn't have been cataloged. It wasn't a requirement. And just pretty much a couple of months before they were ready to ship them out, USDA decided that every mouse tissue of every animal that was ever infected with Eastern equine encephalitis is now considered to be a select agent. So they, out of nowhere, had 2 freezers full of samples of select agent with no record when they were taken. I mean, like, fairly approximate record, okay? And they had to catalog thousands and thousands of samples to ship them out. They decided, screw that, put them in autoclave, kill them all. Lost thousands of samples just because of that regulation. Okay, so it's a lot. There's a lot of bureaucracy involved. Let me tell you, like you spend 2 hours doing experiments and then 2 hours, typing that all in the computer and printing that out and whatnot. Okay, you can see that actually the Eastern equine encephalitis is normally maintained in the birds, and that's true for most of those viruses. Okay, the major reservoir is birds. Humans become, in this case, a dead-end host. They're accidentally infected, either from the birds, from the horses. Okay, horses are not in this picture. Now, 2 more, California encephalitis, which obviously can be found in southwestern United States. It's a Bunya virus, also RNA. And St. Louis. St. Louis encephalitis is the most common viral encephalitic disease in the US. Okay, mostly Midwest and South are affected. All those viruses are mosquito transmitted. Okay. Now this is something worth talking about in terms of ecology. This is West Nile virus. So you can see the distribution of the incidence of the West Nile in 15 years since it was introduced in the US. Most of it in Louisiana, Mississippi, Texas. Well, probably in Texas because there's such a huge, vast, empty areas. You just don't have really people to transmit it to. And by the way, mosquitoes don't travel that far. For some reason, I don't really know why Midwest is so affected. Seriously, I have no idea. My only speculation maybe because mosquitoes that are carried by winds and traffic from here stop between the Rockies. But I don't know. Anyway, West Nile virus, where does it come from? What do you think? West Nile. What continent? Nile River. Africa, yes. It's North Africa. Now it's found virtually everywhere. It's found in Europe, in Africa, in Southeast Asia, all across the globe. South America. In the US, West Nile was not present until 1999, when one unidentified vessel that was carrying a shipment of tires for recycling arrived to New York port from Japan. Those tires, if anyone, a little bit into the CrossFit, people buy tires and have you seen a tire outside? After the rain, what's inside of that tire? There you go. Breeding grounds for Culex pipiens. So those mosquitoes were actually carried from Japan to the US in the tires. Now, imagine you are a mosquito. You just had a pleasant cruise, several weeks, and you arrived finally to the Big Apple. And you carry the virus that normally replicates in birds. So you fly out from the ship hoping for some birds. Have you been to New York? Not so many birds there, mostly humans. So we're going to find birds, a lot of them, in New York. Can they fly that high? Well, probably so. Zoos as well. I don't say that mosquitoes deliberately flew to the zoo, like the first tourist destination for them, not Metropolitan Museum, not Empire State Building, but Bronx Zoo. But turns out birds in the Bronx Zoo started to die because this infection is deadly for birds. They started to die. And a veterinarian in the Bronx Zoo managed to identify that it was West Nile. So it was a first signal that the virus is in the United States. But then the virus started to spread among humans. Now humans are accidental, dead-end hosts for the West Nile. So what changed? What was so particular about the summer of 1999 when the first outbreak of West Nile happened in New York? The summer of 1999 was exceptionally hot. So first of all, heat, first of all, heat, in fact, decreases the number of critters that birds eat. So bird population in New York started to decline because the food supply started to decrease. Second, if you live in a city like New York, where prices are already absolutely exorbitant, and you have a pool, a backyard pool, and it's really hot, and you have to pay for the pool, that thing, the recirculating pump. It's a lot of electricity, right? You also have to pay your AC fees. What you're going to choose first? AC. So you're going to switch off the pump in the pool. And if the water in the pool is not recirculated, what happens? Yeah, there you go. Stagnant water, mosquitoes start to breed. So there's a huge boom in mosquito population, let's put it this way, in New York. And all this bunch of mosquitoes don't have a lot of birds to prey on, so they switch on another extremely common warm-blooded animal, which is humans. They start to transmit virus from birds to humans. And you have an outbreak. And since then, the hot summer with a lot of rain was associated with a lot of West Nile transmission. Now, if we would go back, so we have now 3 million people who have evidence of the previous infection. Doesn't mean that all of them were sick, okay? Some of them probably never ever developed symptoms. By now, we don't have an approved vaccine for West Nile, although several of them are in the pipeline. And most of them actually went through 3 phases of clinical trials, so they're safe, they're effective. All we need to do is to get the approval of FDA. And I don't know if people in the US are going to vaccinate themselves against West Nile, because obviously the rest of the world is not going to pay for it. Come on, Africa's poor, South America's poor, they have other things to worry about. But what I think is interesting here is this. Florida. Marshy, a lot of mosquitoes supposedly, okay? But they don't have that many cases of West Nile. What do you think they do well? From where? From anywhere that would be city. Well, you technically can drain the Everglades, but there would be no Everglades then, so, but they implemented fines for stagnant pools. You either drain it or recirculate it. You can't have a stagnant pool. Actually, there was an outbreak of West Nile in Florida in 2008. Housing crisis, people leave houses, pools are stagnant, mosquitoes breed. Another thing that they do, they have a state program of mosquito control. For this purpose, planes, like airplanes, I don't know about helicopters, probably helicopters too, they spray the insecticide called BT. Anyone heard of it? It's actually certified organic. It's a protein from Bacillus thuringiensis. I don't remember what it does to mosquitoes, but pretty much they die. And these guys are very, very thorough and effective in terms of mosquito control. So it's done really well. Okay. Now, those were arboviruses that I mentioned. Now, non-arbovirus infection. First one is herpes simplex. Affects mostly immunocompromised again, because generally herpes simplex, after the initial infection, what happens to it? It goes latent, very good, and generally speaking, our immune system controls it pretty well. Newborns, though, are a kind of immunocompromised. And transmission of herpes simplex, you can see the herpetic lesion in the brain here, happens when the mother is HSV positive and transmits herpes to the newborn. Now, when mother is pregnant, what happens to mother's immune system? It's kind of, in decline. So HSV can start to replicate. And this is one of the viruses that can be transmitted vertically via placenta. And if the intrauterine infection occurs, the consequences are pretty dire. You can Google neonatal herpes or congenital herpes. The pictures are very disturbing. Encephalitis, herpetic encephalitis in newborns usually leads to the sequelae, neurological sequelae, mental retardation, maybe deafness, various types of sensory impairment, it can be motor impairment. It's really, really a problematic infection. It can be treated with acyclovir. It may end up in death, but even if it doesn't, the outcome is not a complete recovery. Okay, so this infection leaves some sequelae. Another fascinating infection of the brain is JC virus. Right here. It's a polyomavirus. I would say a cousin, like a second cousin of the HPV. Remember we talked about papilloma? Polyoma is kind of similar. It's a DNA virus as well. Now, it resides in multiple places. Brain, but also in kidneys. Actually, every time you go pee, and then you flush the toilet, you immediately aerosolize a bunch of JC virus and you inhale it. I hope you're going to have a good lunch today. But in kidneys, it can pose a problem in kidneys, but compared to what it does to the brain, kidneys is not a major concern. So you can see the staining for the virus in the brain tissue of the immunocompromised patient. And here you can see the lesion in the immunocompromised patient with the JC infection. The infection causes the disease, which is a tongue breaker, which is called progressive multifocal leukoencephalopathy. Yeah, what? Yeah. So progressive, what does that mean, progressive? When disease is progressive, it gets worse. Multifocal, many places. Leuko, white blood cells. Encephalopathy, brain problem, right? Encephalo, brain, pathological problem, right? So it's a brain inflammation essentially with enormous infiltration of white blood cells that destroy brain tissue. This infection, caused by JC virus, is very common in AIDS patients. I want to focus that we have to separate HIV positive from AIDS. In that HIV patients not necessarily have AIDS. That makes sense? Okay? But this infection was pretty much discovered, not discovered, but made a case, a huge case, in patients with multiple sclerosis. So what is multiple sclerosis, anyone? Say again? Is it when your nerves are like overactive or something? They're not overactive, huh? Right. Say again? They're demyelinated, right? What destroys the nerve function? What causes demyelination? Anyone? How do we call these diseases? It's like a class of diseases. Multiple. Exactly, that's autoimmune. So your own immune system starts to attack your nerves. How do you treat autoimmune diseases? Generally. Exactly, immunosuppressants. Now, for multiple sclerosis, we have two very effective drugs, the antibodies, rituximab and natalizumab. Extremely effective, very good drugs to treat MS. And when natalizumab was rolled out and used as a treatment, turns out that every so often, and more frequently than the company, I think it was Pfizer, GlaxoSmithKline or AstraZeneca that rolled it out, they started to encounter the complication, which was the PML. So patients on natalizumab became immunosuppressed, JC virus got reactivated and caused this disease. PML is lethal. There is no treatment. It is progressive and it's lethal. Company immediately recalled the drug from the market, went to FDA and reported the side effect. And then FDA and a company started to think what we are going to do. And they actually reached out to the MS community, patients, and they carried out sort of a consultations all together, and they laid out the benefits of the drug and potential risks of the drug, and the decision was made to bring drug back to the market and put it as a side effect. Because the drug is so good, patient has to choose, for him or herself, whether to use the drug at the risk of developing PML. Not everybody develops, okay? Or succumb to MS without developing PML. It's it gives you an interesting idea, yes.
For developing PML, is it a shot in the dark?
Pretty much, yeah. It's a shot in the dark. You can't predict whether patient will develop. I think people still work on that, on certain maybe genetic correlates or immune correlates for either developing or non-developing. Even people who are JC positive, and we talk about 90% of population at a certain age. Even JC positive people may not develop PML ever. What do you mean? White blood cells get into the brain tissue and start to destroy it. Okay? They respond to the JC virus infection, the brain tissue. Now, subacute encephalitis, toxoplasma. What do we call it? Toxa. A fascinating life cycle includes that little cute kitten and little cute mouse. Okay? So mice transmit the infection to kittens. How? Yeah, cat eats mouse. That's right. Interestingly enough, infection with toxo makes mice and rats fearless. They aren't scared of cat's urine anymore, because they sense cat's urine and they don't come close to the place where cat lives. Not anymore. They pretty much like walk right into the cat's mouth. Imagine Jerry just, being absolutely careless, just walking straight out of his dwelling and right into Tom's hands, okay? Paws, should I say. The transmission to humans is sort of accidental from cats to humans. You can see when you handle the litter, the poop, the cat's poop, that carries trophozoites or cysts, usually it's cysts of the toxo. It can be transmitted, cysts get on the hands, you handle food, if you didn't wash them properly, get in your mouth, toxoplasma develops in you. Now, another transmission route is from cattle, undercooked. Actually, not only cattle, beef, undercooked pork, undercooked lamb, all of it can cause the transmission, okay? For instance, in France, most of population carries toxoplasma. One of the national sort of signature dishes is steak tartare, which is pretty much a raw meat. Very, very rare, okay? So transmission is very common. It is probably the most successful parasite in the world, because on estimate, about 2.5 billion people carry toxoplasma, which is a lot. And generally speaking, this infection doesn't have any risk for immunocompetent cohort, like for us. The problem starts when you become immunocompromised. Again, in pregnancy, when a woman becomes partially immunocompromised, toxoplasma can be transferred from mother to fetus. And since fetus is very immunocompromised, toxoplasma affects the brain, okay, and may cause different types of neurological manifestations. Congenital toxoplasmosis is bad. Another problem is toxoplasmosis in AIDS patients. Okay? In AIDS patients, toxoplasma causes neurological symptoms that can range from confusion and affected behavior to seizures and motor problems. Now, there is a treatment, which is usual, I completely forgot the name, but you don't really have to know it. But there is a drug that is extremely effective against toxoplasma. And you may have heard the name Martin Shkreli. Have you? If you haven't heard the name, it's worth to tell the short story. So the drug against toxoplasma, the patent for it has expired, and Mr. Shkreli, who was a Wall Street pretty much investment banker, bought the patent for the drug. The price of the drug was like $1 per pill, which was cheap. Mr. Shkreli, to buying the patent, raised the price to $700 a pill, which caused immediate outrage among mostly HIV positive community, because people had to pay, fortune for the treatment. And this is not an acute treatment. This is not something that you take like for a couple of weeks. People have to take that drug if they are immunocompromised, they have to take the drug for a very long time. And, expenses accumulate. Now, can government do anything about it? The answer is no. He did everything absolutely legal. It was absolutely notorious, but 100% legal. Well, guess what? I understand it may sound really like I may sound bad in this case, but apparently some government agencies started to investigate Mr. Shkreli, and in 2 months they revealed that he committed some financial fraud, and he was brought to court and imprisoned. So justice, there is karma. Justice finds its ways. As far as I know, he had to sell the patent and the prices went back to normal. Now, we discussed that a little bit. SSP, subacute sclerosing panencephalitis caused by the measles. Okay. So the appearance of the infection may take years after the initial exposure to the measles. Okay. Virus gets into the neural tissue, and during the first stage, if it's diagnosed early, which almost never happens, the infection can be treated to control the virus replication in the brain. So pretty much it's a lifetime treatment. It's a chronic disease. Now you can see the little abnormalities in the subcortical tissue here. And here you can see enlarged ventricles and shrinking of the cortical matter in the advanced stage of the disease. Okay, so it's pretty much progressing encephalopathy, cortical encephalopathy. And at the later stages, the prognosis is ultimately fatal. People do not survive. That's one of the reasons why measles vaccine so good. So not everybody, actually the minority of patients with measles will develop SSP, but do you really want to be the one that does it? So this table summarizes the potential causes of non-arboviral encephalitis. Now, acyclovir for herpes, zidovudine or other antivirals, JC virus is not really well treated, okay? So there are not very many effective drugs. But generally speaking, what is used for encephalitic and meningeal disease is steroids. I want to highlight it several times. Because think about this. What happens during the encephalitis or meningitis? And inflammation causes swelling. Yes, swelling. Swelling increases pressure in the brain, impairs brain function. So the first thing that you want to do, especially with the virus diseases, which you don't really have a lot of options to treat, right? You want to decrease inflammation. And for this, doctors use steroids. In many cases, if they suspect viral encephalitis, they will just start with steroids even before the diagnostics is done. Prions. Kind of talked about them. It's worth to recall them one more time. Neurodegenerative disease, which turns your brain into the sponge. You can see the difference between the affected versus normal. Okay? So glial cells, neurons, and you can see the large lesions in the brain here. Okay? This is the flow chart I'm very proud of. Okay? So that's the bad guy, the bad prion. That's the good prion. They interact through unknown mechanism. We don't really know the exact mechanism. Good guy becomes the bad guy. So it's sort of a chain reaction. Does that make sense? Bad prion converts the good prion protein in the bad one. And they accumulate. And they accumulate, sometimes they form plaques, sometimes they form spongiform lesions. Now, there are several diseases that affect humans. One, probably the most famous, is Creutzfeldt-Jakob Disease, which sometimes is mixed up with Alzheimer's. It's a progressive dementia, although it progresses quicker than Alzheimer's. The incubation period for prion disease can be tens of years. So pretty much, if you're like 70, and you suspect that the deer that you just shot has wasting disease, you might as well just eat it. I mean, by the time you develop prion disease, you may be dead. Okay, long dead. By the way, couple of deers with wasting disease were recently shot and identified, I think in Minnesota. I think so, yeah. So wasting disease of a deer is something like, it's one of the prion diseases. So if you hunt and you eat what you kill, stay away from the nervous tissue at least. Okay. Fatal familial insomnia, something to mention also. Awful disease. Patients can't sleep. Die of mental and physical deterioration. There's no treatment. A few years ago, we finally started to diagnose it, not post-mortem. So patient actually knows what he or she is dying from. I don't know how much better it makes the patient feel. I don't know. Before that, the diagnosis was entirely the post-mortem pathological study of the brain. Slices of the brain were sent to the path lab. Rabies. Rabies is another one of my really favorite diseases. Virus. Sorry, it's a negative strand RNA virus. Bullet shaped. So you can see the glycoprotein envelope, the capsid, and the tightly packed RNA. It causes fatal encephalitic disease, and there are two forms: furious rabies and dumb rabies. The first stages that developing symptoms during the prodromal phase may or may not include fever, may or may not include nausea and vomiting, headaches, but one of the most striking symptoms is changed behavior, anxiety, depression, and I'll get back to it in a second. And then eventually, when clinical symptoms completely roll out themselves, furious rabies is probably better for the patient. Fairly rapid onset and rapid conclusion with death. Patients develop phono, and hydrophobia. It means that they cannot tolerate light, sounds, and they have pharyngeal spasms when they see water. So they have to be fed by the tube. Sometimes they develop bouts of aggressiveness. There were cases when people actually beat the medical personnel, like nurses. And eventually they die of the progressing paralysis. Dumb rabies is slow, may take several months. Pretty much it's encephalitis that crawls from the site of the bite all the way up. If it's especially, mostly it's legs, because that's where you get bitten by the dog or cat or raccoon or fox. Okay? And that paralysis crawls up from the legs through the abdominal wall until it reaches the diaphragm, and then pretty much people will die of the suffocation, mostly. Now, it's a zoonotic infection. So the reservoirs out there, skunks, raccoons, foxes, wolves, okay? Dogs, domesticated dogs can do that, cats also, but as far as I know, we now vaccinate, you have to vaccinate your house animal against rabies, as far as I know. Is that true? I think so. So you can see that in Ohio, it's mostly skunk. Okay, on the East Coast, it's a raccoon. Now, general idea, if the wild animal, instead of running away from you, tries to come closer, this is a rabid animal. Normal fox will run away from you. Normal skunk will run away from you. Normal raccoon will run away from you. If they walk towards you, just don't. Now, transmission is by bite. The farther the bite away from the brain, the more time you have to do the vaccine. Okay, the post-exposure vaccination. The earlier, the better. No more than 3 days after the exposure. All emergency rooms will have a rabies vaccine. Also, another treatment is immunoglobulin around the bite wound. Immunoglobulin will bind to the virus and prevent the subsequent infection of the neurons. Because what happens is virus moves in the retrograde manner through the motor neurons to the brain. Okay? It infects neurons and goes from neuron to neuron, which happens fairly slow. Incubation time may differ. The clinical symptoms can happen in 7 days, can happen in a year. Once symptoms are present, there is very, very, very little hope. By the way, the vaccine against rabies was developed by Pasteur. He was passing it through rabbits for a long time, and actually tested it in a sort of acute experiment. The farm boy who was bitten by a rabid dog in the face several times, was brought to his attention, and he used his vaccine, and it actually saved the boy's life. Since then, boy worked at Pasteur's house as the gardener till they both died. I don't know who died first. I believe Pasteur died first.
Can deer get rabies? Can deer get rabies?
I believe it can, but it's not. It cannot transmit it. Does that make sense? Because it's almost it's, as far as I know, exclusively to circulates exclusively in carnivores. You can technically give rabies to the squirrel, and squirrel bite or rat bite should be treated as a potential rabies bite. Now, it's not 40 intraperitoneal infections. It's 3 intramuscular injections according to a certain protocol. Now, what happens if you develop the rabies? God forbid. No. Now you have so-called Milwaukee protocol. It was first used, surprise, surprise, in Milwaukee, Wisconsin. The lady developed clinical rabies, was brought to the hospital, placed in the induced coma, so her body was cooled down to like 25 degrees Celsius. And some drugs were used to suppress nervous activity, and these drugs, ribavirin and amantadine, were used to suppress the virus replication. So pretty much at this level of metabolism in that induced coma, the virus progression happens really, really slow. And that slow progression allows doctors to try and eliminate the virus from the nervous system. Now, doesn't mean that the person, after the Milwaukee protocol, walks out of the hospital room unaffected. This lady, actually there were I think 2 or 3 patients who were treated according to this protocol overall, and they all recovered, but it took them years of rehabilitation, because once they consider to be rabies-free, their neurological functions are severely impaired. They pretty much have to learn how to walk, how to talk, so it's like suffering from a severe stroke, although they can recover the function. So if you get bitten by a skunk, run, okay? We're going to take a break now.